Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. Welcome to the Chiropractic Research Breakdown, where each week we go over the most relevant chiropractic science and philosophy to empower you to change the health of your community from the inside out. I'm Dr. Anthony Pellegrino from ChiroEdge, and I am excited, very excited for this week. We are going to go over one study, and one study only. It's called Atlas Vertebra Realignment and Achievement of Arterial Pressure Goal in Hypertensive Patients, a pilot study. You may have heard of this referred to as the Dickholtz study. When people talk about chiropractic and heart health, this is probably the study that they are referencing. If you have ever heard anyone say the words chiropractic care or an Atlas adjustment is the equivalent of 2 blood pressure medications, this is the study that we're talking about. So with that being said, let's dive into the Dickholtz study, published in the Journal of Hypertension Research, I think is what it's called. Thought I had it written down. Well, that's embarrassing. Yeah, I think it's Journal of Hypertension. I'll look it up by the end of this. Anyway, stats to know. In 70% of hypertensive cases, individuals require 2 or more antihypertensive medications to achieve blood pressure goals. That's nuts, that antihypertensive. In 70% of people who have hypertension, they require more than one. They require 2 or more antihypertensive medications in order to get themselves to a goal blood pressure. They say that minor misalignment of the atlas vertebra can potentially injure, impair, compress, and or compromise brainstem neural pathways. The relationship between hypertension and presence of circulatory abnormalities in the area around the atlas vertebra and posterior fossa of the brainstem has been known for 40 years. That's pretty nuts. Studies show the compression of the left medulla oblongata at the base by looping arteries was present in 51 of 53 hypertensive patients who had left retromastoid craniectomy and microvascular compression. The very same study that found that also found that that compression of those arteries was not present in normotensive patients. MRI studies show that 90.5% of 32 hypertensive cases had compression between the vertebral arteries and branches and the lateral aspect of the brainstem. MRI studies also show significant association between compression of vertebral arteries and changes in posterior fossa of hypertensive but not normotensive individuals. These associations cause the authors to hypothesize alterations in atlas anatomy can generate changes in the cerebral circulation that may be associated with elevated blood pressure. To clarify from earlier, this was published in the Journal of Human Hypertension. So that was their hypothesis. Let's see what they did. They looked at 50 people with stage 1 hypertension. Now, just so you guys know, stage 1 hypertension is about 130 to 139 systolic, or with 80 to 89 diastolic blood pressure. They grouped 50 people into 2 different groups. 25 received a sham adjustment, which was pretty similar to NUCA, except for they did a different angle of the headpiece, and they didn't contact the atlas. The other 25 received a NUCA upper cervical adjustment. The evaluation includes, and I'm sorry, I get really excited because over past weeks, months, however long you've been listening to this podcast, you've heard me rant and rave about so many studies that we have in chiropractic and not in chiropractic, where there's no evaluation. It's just a manipulation. But let's talk about the evaluation that Dickholtz and co. did. Supine leg check, paracervical skin temperature, postural analysis using an anatometer featuring left and right weight-bearing scales and other calibration instruments, degree of pelvic distortion in the frontal and transverse planes, pelvic distortions in the horizontal plane, lateral displacement at C7 or T1, based on X-ray, weight-bearing inequalities, pre-alignment X-rays in 3 different dimensions, lateral, vertex, and nasium, and post-alignment radiographs. They adjusted people. Let's see what they found. The systolic on average dropped by 14 points. Okay, 14 points systolic. The diastolic dropped by 8.4 points. Both of those measurements were statistically significant. Pulse, there was no change in pulse between the sham group and the experimental group. The frontal, and this is actually what's really cool, is what I really like about the study is they're not just measuring the outcome measure of the symptom, but they're actually going back and talking about some of their indicators of subluxation that were present and saying, hey, not only did the blood pressure change, the one thing that we're addressing, they don't use the word subluxation, which makes me rip my hair out, but whatever. This is 2007. These guys have won way more for the profession than I have, so I can't get too upset about it. What they did go back, though, is say, hey, not only did blood pressure change, did our indicators of subluxation change? Well, they found that frontal and transverse plane pelvic distortion both improved, and the lateral displacement of C7 improved, which was really cool because they only adjusted the atlas, and they saw the C7 and T1 improved. They saw that the weight differential, using the anatometer, did not change, though. Because the average antihypertensive agent drops blood pressure by 8 millimeters of mercury in individuals with stage 1 hypertension, what they concluded was that in the presence of subluxation, of atlas misalignment, a specific adjustment using the correct specific indicators, right, to ensure that the subluxation was cleared, because the average antihypertensive agent drops blood pressure by 8 millimeters of mercury, they concluded that when those are present, that adjustment is the equivalent of 2 simultaneous antihypertensive medications. They raised some questions. How does misalignment of C1 affect hypertension? Is there a cause and effect relationship? And is C1 misalignment a risk factor? What they say is, and I love this because it's such a ballsy conclusion. Sorry if that wasn't safe for work, but it is. Just listen to this. And this is the way that we should communicate, guys. This is how we should communicate. What is clear is that misalignment of the atlas vertebra can be determined by assessment of the pelvic crests. Okay, so I'm assuming that when they say that they're talking about pelvic distortion in the frontal and transverse planes, which we saw had statistically significant improvements. They said this should be considered in those who have a history of hypertension and require multiple medications for treatment. Additionally, it should be considered in those with refractory hypertension, a history of neck injuries, independent of the presence of pain, because no one who was assessed in this study was actually experiencing neck pain, which is really interesting. They then go on to recommend that primary care providers who would prescribe these antihypertensive medications do a pelvic analysis to see if there's pelvis distortion, and in the presence of that, because we know that C1 misalignment would cause that pelvic distortion, to refer them to somebody for atlas realignment. I love that conclusion. Hey, listen, we want to show you how to check for subluxation. We want to show you what indicators are present that are causing us to actually see this change. And when those are present, and if those are present, it makes sense to make sure that the atlas subluxation is corrected, is adjusted, is realigned to allow the body to heal and function 100%, because it's a better option, and you can always do drugs later, but it's a better option for right now. If you're not getting changes with blood pressure in your chiropractic office without potions, lotions, pills, or supplements or anything, if you're not getting that change, step up your analysis. Step up your pre-check analysis. Step up your adjustment game, but most importantly, step up your post-check analysis to make sure that the subluxation that you assessed for actually flippin' cleared. I hope that gets you a little bit fired up. It really fires me up. I had a post on my Facebook earlier today on the ChiroEdge Facebook. I hope you guys are on there, posting good stuff on there all the time. I had a post on there earlier today that said, imagine guys, if chiropractors cared as much about the quality of the adjustments that they give as they do about the quality of the supplements that they give. Could you imagine? I've been to seminars, adjusting seminars in series, and seeing people checking out and on their phone all the time and blah, blah, blah. I'm not going to do anything. I'm just going to keep doing my flying 7. And then seeing those very same people at nutrition seminars who grill the instructor because they need to know every little thing. They need to know every little aspect of every little supplement, and they need to understand it. And it's like, dude, you didn't care at all when we were talking about the adjustment. What the heck are you doing? What are you doing? Why are you a chiropractor? Stop calling yourself that. That stuff's great. It's important if you want to do that stuff. I disagree with you. Awesome. But please care more about the adjustment. Please care more. Please care more. I promise you that a well-delivered adjustment using an actual analysis, a well-delivered adjustment is going to do way more for your practice members than a supplement that is non-GMO. I promise you it is. And luckily data supports that. And I'm not just making that up. Hope you guys, sorry for yelling at you today. I love you guys. This is so much fun for me, this podcast. It's been an interesting year for me. Huge changes personally, professionally, and the words of encouragement that I've received from you guys, from people in the U.S., from people abroad, to continue with this podcast, to continue delivering this message is, those words are something that I keep with me very much. I'm going to keep delivering for you guys each and every week. Next month, if we finish up heart health this month, make sure you guys jump on. Get a 2-week free trial of the ChiroEdge service, which takes 3 studies a week, just like this, puts it into patient newsletter format. It's not me ranting and raving about the quality of chiropractic care. It actually takes this and makes it digestible for your patients. People say things all the time like, it's amazing to see my practice members asking the right questions, referring in better cases, right? Referring more. It's amazing to see my retention change. People get really excited to see the constantly varied handouts. We make it really beautiful. We don't put too much text on the page. We make it with your logo, with your practice member information, and we give you 3 a week because we want to make sure that you build up relatively quickly a good base for when people ask questions about specific issues. And also because if you guys are starting new practice members and they're coming 3 times a week, I want you to have something different for them every time that they come into your office. All right, guys. You guys can get that 2-week free trial at ChiroEdgeMedia.com. We're finishing up Heart Health Month this month. I'm excited to announce we put out to our people who are part of the ChiroEdge subscription, we put out a survey monkey for them to ask them what themes we want to go over every single month. And I'm super excited that next month we're going to be doing Multiple Sclerosis Awareness Month. We're going to be having an article every week on multiple sclerosis. That's for March. And I'm really excited about that because I'm very, very, very passionate about chiropractic care and MS specifically. I'm very excited about the research that's out there on chiropractic MS. I'm excited to see what medical doctors have said about the alignment and degeneration of the cervical spine post-whiplash and trauma and how that relates to multiple sclerosis. So make sure you guys subscribe, rate, review to the podcast, the Chiropractic Research Breakdown. Make sure you guys are following us, facebook.com/ChiroEdge, instagram.com/ChiroEdge. And most importantly, make sure you guys are going out there and actually slaying some frickin' subluxations, all right? Because if you're not, chances are you haven't listened this far in the podcast. But if you're not, there's people who are suffering. So step your game up. I love you, and thank you for holding yourself to a higher standard.